Hi, I'm Dr. Steve Mew, and today we're going to talk about hip flexors and how they affect the low back and the hip. We'll take a look at how we treat them in the office, and we'll show you a couple of exercises you can do at home to keep your hip flexors from causing you low back or hip pain. The hip flexors are a set of muscles that start in the pelvis or spine and attach onto the femur. These muscles allow you to bring your knee to your chest. Due to their structure and the function, they can have a large effect on the low back or hip. One of the most common causes for hip flexor problems is prolonged sitting. Sitting in a desk keeps the hip in a flexed and shortened position. Over time, the hip flexors weaken and lose their flexibility. Eventually, this will present as low back or hip pain. In the office, we use a variety of techniques to treat hip flexors, including active release techniques, chiropractic manipulation, and kinesio tape. Although each injury is slightly different, the goals of the treatment are the same. We want to restore proper movement, correct alignment, and of course, reduce pain. Suzanne is a volleyball player that came in with low back and hip pain. Through our examination, we've determined that she's got tight hip flexors. We'll start by working on the hip flexors. With this technique, we're going to take a firm contact through the abdominals and into the hip flexors. Next, Suzanne is going to move her leg throughout the entire range of motion. And we'll do this 3 to 5 times or until the muscle releases. Depending on the injury, we might need to move down to the rectus femoris or the upper quad. We'll treat this in a similar fashion to the previous muscle, but this time we're going to have the knee bent to target the upper quad. Next, we'll adjust the low back and the hip, freeing up any restrictions in the lumbar spine and correcting alignment in the hip. To complete the treatment process, it's important to have an active component to help reinforce the work we've done in the office. Now here's some exercises you could do at home to help keep you from injury. We'll start with the hip flexor stretch. We're going to start on one knee. The upper body is going to be fairly neutral. The back knee is going to be turned in very slightly, and then we're going to lean forward and then turn the body away. We're going to hold for 30 seconds, and we'll do twice each side. So next we'll do an upper quad stretch. It's going to start similar to a regular quad stretch, where the knee's going to be bent. Suzanne's going to grab her back foot and bring it to her butt. And we'll add some extension in the hip to focus on the upper quad. Once again, we're going to hold for 30 seconds, and we're going to do it twice each side. Finally, we'll do a bridging exercise. This is a great exercise for low back and hip stability, as well as opening up the hip flexors. We'll start with Suzanne lying down, knees up, feet about shoulder width apart, and arms to the side. Before every rep, we want to engage the core muscles to help stabilize the trunk. Next, we want to focus on the glutes and slowly raise the pelvis up. The legs and the trunk should be in a straight line, and then slowly down. Every rep should be controlled and slowly up and slowly down. We want to do 10 reps and 2 sets. I hope you enjoyed these stretches and exercises that you can easily integrate into your daily routine to help loosen your hip flexors and to strengthen your low back and hip.